All right, hi guys. I am going to show you some of the settings and how we go about setting up our ultrasound machine. These big towers that are in our closet there, we have about 5 or 6 of these units. And we also have 2 kind of newer touchscreen kind of units. They're always going to have the same available settings to you. You just kind of sometimes got to click around until you find exactly what you want. So I'm going to show you once we're plugged in. When I turn this unit around on the back here, there's a switch. So this is what I'm going to flip to turn it on. And then you can see this little dial right here. This is going to change the contrast on the screen. So sometimes if it's too bright or too dark, I can just change that and twist that a little bit. So see here, it's a little bit bright. So it changes the contrast of the screen so that you can see it. So change it kind of how you can see it best. Okay, so these are our options when we pull up our screen. For the purpose of this class, we are going to be choosing our ultrasound option. So it is going to load our protocols for us. This is going to be the first screen that you see. So I'm going to be able to edit each and every one of these parameters, and it will come back to this screen at the end so that you get like an overview of what you're doing. All right, so looking at the right side of my screen here, first thing that I have to be able to choose is my frequency. So like I said, most machines are already preset. This machine, I only have the 2 options that we talked about, right? I only have 1 megahertz or 3.3 megahertz, okay? So if I'm looking for a deeper tissue, so I'm looking to affect like 3 to 5 centimeters, I'm gonna choose my 1 megahertz. If I want something more superficial, there is my 3.3. Okay, so first things first, I need to choose my frequency. Then I work my way down. Do I want thermal or non-thermal effects? So for my duty cycle here, I have 100%, so I'd be getting thermal effects. There's a couple other options that it gives us. This machine gives us 10%, so holy cow, very, very little to no thermal effects. 20%, that is our standard when we think of non-thermal effects. Gives us 50%, so 50% on time, 50% off time. Maybe if I'm a little worried about exacerbating a little something, but I still want some good effects, I can choose that. Otherwise, we're back to 100, okay? So I'm gonna leave this on our thermal effects there. Next one I told you, here in America, we are operating on our watts per centimeter squared. This button automatically comes up as watts per centimeter squared. If you hit it, it switches to watts. Remember, that's going to be a different value there, so we want to make sure that we are measuring in watts per centimeter squared because that is how we are learning it. So if I change this number, it means something different in watts than it does if I am in watts per centimeter squared, okay? So make sure before you start that this is in watts per centimeter squared. Next one, I get to edit my treatment time, my duration. So remember, this is going to be 2 times the size of my ERA, which is my effective radiating area, the size of my transducer head, right, this big. So as long as I'm treating an area that is 2 times this, I can go anywhere from 5 to 10 minutes, okay? And that will be adequate treatment time to have tissue effects. I'm gonna choose 7 minutes. I can choose anywhere in there. It's based on what my patient can tolerate. If they handle their first treatment well at 7 minutes, I know I can get even better effects next time if I bumped it up to 8, 9, or 10 minutes. So as soon as I can go up or down there, down, up, and I'm gonna select that one. Okay, now that I have everything there, I need to remember to set my intensity. This is my intensity. Right now it is at 0. I have this dial here, okay, that is going to allow me to set my intensity. It kind of swivels up and down. So if I have a frequency of 3.3 megahertz, it means that I'm going for very superficial tissues. I do not need a higher range of power. So I can be anywhere from 0.5 watts per centimeter squared all the way up to 1 watt per centimeter squared. Okay, so for this one, I'll probably choose 0.8. Let's try it there. Okay, so this looks good. Everything here looks like I am set up exactly the way I want. I'm always going to double check everything that I have here. Okay, so my frequency tells me that I'm going for more superficial tissues. I am going for thermal effects. I am in watts per centimeter squared, and I fall within a range of power that is appropriate based on my frequency. And my treatment time is falling within that 5 to 10 minutes for the area that I'm going to treat, which is my 2 times my ERA, which is the size of my transducer head, right? Okay. From there, you guys, you will hit the start button. I will do a second video that shows the actual application. I just wanted to give you guys a close-up in terms of how we can set our parameters, okay?